Hi, my name is Dr. Scott Farley. I'm an orthopedic spine surgeon, and the question we're going to discuss today is, was my disc herniated from an accident? This is a very complex conversation. It's a difficult conversation because I think there's lots of nuances to this. There's many sources online that will discuss disc herniations, car accidents. There'll be lots of information regarding patients between age 40 and 80 routinely having disc bulges and herniations, and that they're not from an accident or they're from degenerative changes. And so what we're going to talk about the most obviously in relation to a motor vehicle accident is, what was someone's history prior to the accident? Did they have any pain? Did they have any record of pain? Have they been treated by a doctor, a chiropractor, a pain management doctor, seen a surgeon, missed work? So again, this is a time-related issue. There's an incident that occurred that presumably changes someone's life. Now the question is again, what's causing that pain from that accident or incident? And so many will have you believe that it's not possible to have a disc herniation after a traumatic event. This categorically doesn't make sense, nor is it true. Again, you'd have to have an MRI right before an accident and then after the accident. And the MRI is a magnetic resonance image to determine if there's a change in this short window of time. Now, realistically, in the real world, this doesn't really occur very often. From an MRI after an accident, we cannot usually tell the acuity when a disc herniation occurred. That is not possible. So again, we have to use our clinical judgment. Myself as a spine surgeon, we have to get the proper information from the patients. We have to understand their history. We have to understand their pain. And now, in a lot of the information that I've been seeing online in writing would be that if a disc herniation occurred acutely, you would expect, as they'll put in quotes, pain shortly after the incident. Well, what does shortly mean? This is the main point of this. Is shortly within 2 minutes? Is shortly within 2 weeks? Well, I would say that everybody's an individual, everybody's different, everybody responds differently from an accident. So I think that when they use the word shortly, it's important to try to define what that means. And I'll tell you what I believe that means. I have extensive history in dealing with patients with spine pain and disc herniations. Shortly would mean within a first few weeks. Clearly, if there's a large disc herniation, it might occur within the first 5 minutes. I can tell you in my practice, I routinely see patients that have injured their discs that start having increasing pain shortly after, meaning within the first few hours, to then progressing and becoming significant within the first few weeks. Again, nobody's bodies don't read a textbook. They don't have that it has to happen in a certain way. I have patients who have large disc herniations, 5 and 6 and 7 millimeters, that don't have very much pain at all. I have patients who I believe have 2 millimeter disc herniations that have significant pain. And so this goes to the experience and the education and training of the provider seeing the patient, which requires, as we've been talking about, taking down the history, looking at the physical and doing a physical exam, viewing the images by the provider, and synthesizing and putting this information together. Now, as you would imagine, in the spine, in the neck, and in the lower back, as we've talked about, the disc is very close to many structures that can cause pain, meaning the facet joints. There's a joint on the right and the left. There are numerous ligaments, facet capsules, muscle insertions that all have the ability to produce pain. And so I think it's even more important to understand the fact that if you're told, if you've had an MRI, and that there is a disc protrusion or bulge and that it has to be from the disc, that this probably is too simplistic. Pain occurs from the back fibers of the disc that can be just disrupted. The disc can be torn, causing pain where there are pain fibers. Given the distances, the short nature, the tight, compacted nature of the disc in relation to the joints and the ligaments and the muscles, patients routinely will have pain from all of these sources. There's a percentage of pain from the joint, a percentage of pain from the disc, a percentage of pain from the ligaments, and then also pain generated from the muscle. So leaving my office, I would have someone routinely coming in thinking and believing that only their pain may be from the disc, which is possible depending on the person. But then I also have people understanding with the use of their MRI their physical exam, and the model of their spine that they are also likely having pain not only from the disc, from the joint, from the soft tissue, muscle insertions, and the ligaments. And so I think it's important to understand the timing from an accident, the timing of when pain is possible. You can think of it this way, that if you go to the gym and I went and worked out, I haven't worked out in a period of time, I will have really sore or a little bit sore the day after I work out, but then really sore 2 days after I work out. And I call this kind of the after workout soreness phenomenon. The same is true with an accident. When you're in an accident and you're in the emergency room, you'll be focusing on your most significant pain. Typically patients will go home and in the first few hours they'll have increasing soreness. They'll wake up having soreness in body parts that weren't even bothering them a few hours, and then 2 days later be having pain in parts that they didn't even have the few hours before then. So the pain changes, the stiffness changes, and the symptoms change. So this is an important fact that everybody that's experienced an accident or a trauma would understand. So I think the other important fact to understand is that when you're being seen by a clinician, the information there is significant. We see a patient, we see your physical exam, we have the ability to talk, look at the whites of the eyes of a patient to understand what their life was like before an incident or an accident. We look at the MRI with the patient and we can synthesize that information. And as you can see from other online sources, is people will say that you can't have pain from a disc herniation starting 2 weeks after, that it has to be within the first few minutes, that because you didn't have pain in your neck when you were seen in an emergency room a few hours after the accident, it's impossible to have pain in another body part. This is clearly not the case. So in a litigation type situation, or even in a workman's comp type situation, it becomes clear that patients unfortunately have a peer-to-peer review, a paper review from another doctor. They don't have the ability to see the patient. They typically don't even see the MRI. They're simply looking at records and making a medical opinion. I believe that if any of those types of providers that had the same information I had, that had the same experience, education, and training that I had, that they couldn't help but come to the same conclusion that I'm having. And so again, a paper review is so limited and only gives such a small window into a patient as an individual and actually how their life is affected, what their physical findings are, and what their MRI shows. It would be impossible to make a true good medical opinion, diagnosis, and forming a treatment plan based on simply looking at paperwork.